this Challenge Wednesday, we have our patient Maurice. All right. Maurice is my middle name, by the way, y'all. Kyle Maurice Rice. It's Maurice tonight, baby. All right. So Maurice has attended physical therapy for his recurrent, non-specific lower back pain for the past 3 weeks. All right. The patient has been treated with mechanical lumbar traction for the past 3 sessions and has reported significant reductions in pain after each treatment. So the therapist would like to continue traction. Which of the following traction parameters is the most important for this patient? So we have A, 25% body weight for 15 minutes. B is 10% body weight for 60 minutes. C, 50% body weight for 25. And then D, 30% body weight for 45 minutes. All right, so let's go ahead, lock this in, knock this question out. When we look up at the top, we start off, Maurice has attended physical therapy for this recurrent, non-specific lower back pain. Doesn't really tell us where it's coming from or anything about it. We just know that this patient has lower back pain. The one thing that a lot of people will do right now is they're going to start to assume what type of lower back pain the patient's having, whether it's disc, muscle, or whatever. It doesn't say anything about that. It says non-specific recurrent lower back pain. All right, so don't read too much into it. And it says that the patient's been having that or attending at least physical therapy for the past 3 weeks. Okay, cool. The patient has been treated with mechanical lumbar traction. All right, so we're trying to decompress the spine in some sort of way, and has been doing that for the past 3 sessions with reports of significant reduction in pain. That is important. All right, significant reductions in pain, been treated for the past 3 sessions. Good. That's what we like to see. That's perfect. Now it says the therapist would like to continue traction, which makes sense. Which of the following traction parameters now is the most appropriate for this patient? So here's the deal. In order for you to get this question right with confidence, you have to know a bit about your traction protocol. Obviously, we're talking about the lumbar spine. So you have to know lumbar traction protocol. What should we or should not we be doing? Let's go down to the answer choices. Let's dissect these out. All right, so A says 25% body weight for 15 minutes. Before we really get into this and start knocking these answers out, and I was checking the answers that y'all put down today. I was checking it to see who would have that one key element to help you eliminate answers really quickly. Really quickly. That one key element is this idea of friction. You know, when your body is laying on the bed and you're trying to do a mechanical traction, there's a level of friction that's there. And that means that, well, the body has to slide a certain amount in order for you even to get that traction. The body has to move a certain amount for you even to get that level of traction. I mean, y'all know what I'm talking about, right? You're laying on the bed and it's like even to slide over, you get the friction that's on the actual, mattress or bed or plinth or whatever you're on. There's friction there. So what is the amount of force that we have to use to even overcome the friction? This is it. This is important right here, baby, because that amount is 25%. We have to add or increase 26% of the body weight or more in order to overcome friction. Y'all hear me? You have to use 26% in order to overcome just friction. So A and B, baby, A and B is already out, wouldn't y'all say? Based upon what I just told you. That's a key element. That eliminates answers off so quickly, make your head spin. So already I don't like A and B. Not to mention that we have to look at the timing as well for something like traction, whether it's the cervical spine or the lumbar spine. Going over 30 minutes is contraindicated. So your patient should not be going over 30 minutes of mechanical traction. So that automatically would eliminate B just based upon that as well. Wouldn't y'all say? All right, so now we're down to C and D. All right, let's freaking get it. So we just said we needed 26% or more. The patient is having, it says up in the question that the patient has significant reductions in pain after each treatment. The patient's getting better. So there's no reason for us to be sticking around just 26%, the percentage that's required to just overcome friction. There's no reason why we're sticking around 26%. And if we truly want mechanical traction, I mean, actual separation of the lumbar spine, we need at least 50% of the patient's body weight. At least 50%. Therefore, C's looking great, right? 50% body weight, that looks good. 25 minutes, I told you maximum's 30. That looks good. Right now, it's the best answer. When we look at D, we see 30%. That's hanging around 26. I already kind of don't like it. Why is it that low? Let's look at the last part of the answer. It says 45 minutes. We know that it's contraindicated to go over 30. Let's go ahead and eliminate D, people. It's out, leaving us with our final answer of C, 50% body weight for 25 minutes.